Previously, in the old days, we used to start the treatment at the age of 12 or 13 years when the patient has all the permanent teeth out. But these days, we have changed completely the concept, and the American Association of Orthodontics, they advise the patient to come and see the orthodontist at the age of 7. Why? Because we need to see if the patient has any skeletal issue. I mean, if the patient has only like little crowding, it's not a big deal. We can keep the case until the age of 12. But if the patient has a problem with the bite, with the maxilla, with the mandible, whether it's a cross bite or protrusion of the mandible, or a huge overbite or overjet, so in this case we need to start early the treatment. We are transferring the hard case into easy case at this phase, which we call it the phase of interception or first phase of treatment. And then once we transfer the hard case into easy case, then later on at the age of 12, we start the second phase of treatment by having braces or aligners, and the case will be much easier than if we start in a later stage. So why we do this in case if we can do it in one time in a later stage? Actually, when you start early, we reduce the risk to have a lot of extraction or surgical procedures, and even the bone is more malleable and it's much easier to move. And that's why we advise all the parents to bring their children to the orthodontist starting from the age of 7.